everyone. My name's Jacinta Bell. I'm from LifeWorks Occupational Therapy, and we really work with people who have mental health and chronic pain and chronic conditions in order to live life well. And I'm here today with Holly Repose, who's one of our excellent level 2 OTs. And Holly has a particular interest in the mind-body connection and working with complex chronic conditions. So I'm going to hand over to Holly and ask Holly to share with us a bit about her role within our practice and also what's led her to focus on that particular area of practice.
Hello everyone, so my name's Holly. I've been at LifeWorks for the last 4 years and have been working a combination of NDIS, private and workers' compensation cases, and I work out of our Mount Lawley clinic here on Fridays, and also I've been recently working out of Pain West on Thursday afternoons with pain specialist Dr. Mark Schutzer, and I also work in the community. And I've really been enjoying kind of leaning into working with people who are neurodiverse and might have a combination of a mental health condition, complex trauma, as well as difficulties with sleep and with chronic pain. Being kind of considering myself a mind-body OT and really exploring those connections between how our mind and our body is very strongly linked. What led me to work in mental health and working with complex conditions and chronic pain was actually I have a family member who has had an experience of mental health and has been, in and out of the mental health system, and kind of getting to see his journey over his lifetime kind of really encouraged me to, wanting to work with people who are experiencing a mental health challenge, especially as I saw discrepancies in how the public mental health system treats people with the mental illness. And so that was something that I really wanted to kind of explore. And then when I was studying OT, one of my placements, I had the opportunity to have a placement in a mental health day unit. And I got to learn how OT can work with and support people who are experiencing a mental health challenge to, work towards their goals and to live the life that they want to be doing by, learning skills and doing things that they enjoy. So yeah, I was really lucky to have that mental health placement. And then, when I graduated, I did a combination of different roles, and then, reached out to Jacinta and I learned, what LifeWorks offer. And I thought, well, this is, really the place that I want to work at. And that this, place really aligns with my values and aligns with what's important to me. And, so yeah, and then 4 years since, I'm still here.
Oh, that's great, Holly. That was a really good overview of your journey so far as an OT. And really, it's really inspiring to get that life, I guess, that lived experience of having a family member or you yourself having a health condition that you're having to manage. It really provides that empathy. You can see the gaps that are occurring in the systems that are currently available, and you can work to be filling those areas of need.
Yeah, that's right. And that was something that I forgot to mention is my own personal experience. Having been diagnosed with a sleep disorder, was diagnosed in 2019 with a sleep disorder, and that's something that I've had to manage, over the last couple of years since being diagnosed by, working part-time. And I think that has really helped me to build empathy and understanding, which I find that my clients have connected with, knowing that I have that past experience. And I was also a participant of the NDIS until recently when I decided to leave due to being hard of hearing. And so, having that first-hand experience of being a participant on the NDIS also has helped me to build connections with people as well. I'm no longer a participant, but I was previously.
Yeah, that's great. And you can see all of the frustrations and the challenges of working within that system, from a participant perspective as well as from a provider perspective. So, yeah, I'm sure that's really valuable to your clients.
Absolutely.
Yeah. So tell me a little bit more about your approach to working with clients in regards to sort of mind-body connection and how you tailor your interventions to their individual needs.
Yeah, well, one of my primary values is curiosity. So I always love to approach things from a curiosity lens and really meeting the person where they're at. I like to treat everyone individually. I really like to spend that first session with people to identify who it is that they are as a person, like what is important to them. I view the person as a whole person, so viewing them holistically, and like to utilize their unique strengths and interests to tailor that into sessions. So, for example, I have a gentleman that I've recently started working with who is autistic and has a special interest in computers and technology. So I've been utilizing his skills and strengths to help him to identify what it is that he would like to be working on. Using different tools, using AI, and he's been engaging really well. Engaging really well with me. So my approach to treatment is really just being flexible, meeting the person where they're at. I like to utilize a lot of different strategies and tools during sessions to help people, especially if they're neurodiverse, to stay on task, like using whiteboards, using timers, making sure that I'm reflecting back on their goals and having lots of opportunity for reflection, and also offering clients choice for what it is they want to be working on that session. So it's just really flexible, very curious, adaptable, and creative.
Sounds great, Holly. That sounds that you're really adapting your care to the needs of the individual, and you're not sort of not applying a cookie cutter approach. You're really every time you're seeing someone, it's probably quite a unique process that you're going through. Yeah,
absolutely. No two sessions are the same.
Yeah, that's fantastic. So tell me about, you mentioned one client, but perhaps you could tell us about a success story of somebody where your intervention has really influenced positively someone's quality of life.
Yes, well, I have a lot to choose from, but I did, reflect on this, and I had a recent experience with a lovely lady that I've been working with for a couple of months now, who, experiences a psychosocial disability and has 3 children, and those children were taken out of her care due to her mental health, and she was hospitalised at the beginning of this year. And the first couple of sessions with her, it was quite challenging. She was often quite emotionally dysregulated. It was quite hard to identify kind of what she wanted to work on. It was clear that her primary goal was to get her children back. And so I started working with her, developing some distress tolerance techniques, working on some mindfulness, and also looking at things from like spirituality is quite important to her. So, looking at things from a spirituality lens as well, and her connection with land and connection with culture. And so, over the last couple of months, her resilience and her ability to manage distress has improved remarkably, to the point where she does have her children back. That has been, amazing to see her resilience and ability to cope. And we had a wonderful session where we just went for a walk along the river, and she participated in some cultural practices, and I was just able to witness that and be able to see her kind of growth in such a short period of time. So that's been a really amazing experience for me as an OT, to really support someone towards their goals, but also, like I mentioned, building their resilience and ability to cope.
Wow, Holly, that's a very heartwarming story. And yeah, what an amazing difference that makes to that client's life, you know, that she's been able to fulfill a primary role that's really important to her. Yeah.
That's right. And what I, kind of mentioned to people is that, like, I feel like I do very little. I'm just providing people with the tools and the skills, but, she's the one who did the work. She's the one who actively, outside of our sessions, one of the things that she's achieved, which has been amazing, is brushing her teeth every day. Like, that to the average person seems like a really small thing, but to her that was like huge, and something that she's been able to maintain even on bad days, still be able to brush her teeth. It's like, I did nothing. Like, I just provided her with, some routines and some visuals and some general skills, but she's the one who's maintained it and done the work.
Yeah, and that's when you know you've really done your job well, is when somebody doesn't need you anymore, because they have absolutely learned the skills and can continue to grow without you necessarily having to be there. So it's
Exactly.
Yeah.
That's definitely my favorite part, is getting to see people to flourish and no longer rely on us as much.
Yeah, that's fantastic. So tell us a bit about what a client can expect when they first come to see you. What's the process? How does it all happen? And how do you support them? You've mentioned a little bit about this already, but how do you support them through their journey?
Yeah, really good question. It obviously depends what the referral is for and where it is that they're seeing me, if they're seeing me at Mount Lawley or Midland in the community. But generally, they can expect the first session to be, around about 1 hour. And, usually we'll spend the first couple of minutes just explaining who I am, what my experience is, and what the client can expect from therapy, or if it is, if they're coming for a functional capacity assessment, then obviously explaining that process of what the functional capacity assessment is. And then I spend a majority of the session gathering information about the person, identifying what areas or what goals they might have, or areas I'd like to work on, information about their medical history, their disability history, their social history. All of that information will help me to identify what interventions might be, might work for that person, or what goals or what things that we could possibly work on. And then it's also a good opportunity for the client to ask lots of questions. I always encourage people to ask lots of questions. If they can't think of anything at that time, then they're, obviously welcome to reach out after their first session if they do have any further questions. And then, depending if they're an NDIS or if they're a private client, then, so if they're private, we usually will write to their GP to say, this is what we've discussed and this is what the treatment plan is. If they're an NDIS participant, then usually if their support coordinator wasn't present at that session, then I might, give a little brief email to say, this is what we discussed and this is what the plan is. Then, signing the service agreement and identifying kind of how many sessions we think we might need. And yes, that usually takes up the whole hour. Sometimes it's over, sometimes it takes more than that. And also sometimes if people can only tolerate, a shorter session, then like I said before, I can be flexible with that. And I'm also available over telehealth if for whatever reason someone's not able to, come into the clinic or not comfortable with me coming into their home, then, that's also an option there. And then, like I was talking before about how I support people throughout their journey, is that it's really a flexible thing, meeting people where they are at each appointment. And I do like to try and review goals, at a frequent interval, whether that be every couple of months, 6 months, when their person's plan is up for review, just to make sure that we're tracking along with, what we've identified. And yes, that's kind of really the gist of how I support people. It all just comes down to flexibility and person-centered care.
That's great, Holly. Sounds very, it sounds like people are kind of enveloped, and really, welcomed into your sphere, so and given space, I think.
Yeah, absolutely. And that's the other thing as well, is like working with that person's support network as well. If they have, if they've got a GP, a specialist involved, if they've got a physiotherapist. Here at LifeWorks, we have, a wonderful physiotherapist, Mel, and our psychologist, Natalie. I've worked quite closely with both of them to provide sort of a multidisciplinary approach to care. And also, people are under mental health, community mental health, and working with the case managers, and really to provide that kind of holistic care with their support coordinators, working with their support workers. So that's kind of, like you said, wraparound approach.
Yeah, and that collaboration is just so important, and so it really helps people's care be consistent, and make sure that there's no gaps that people fall through. So good. Okay, thank you. So lastly, Holly, why do you believe that our practice, LifeWorks, is the best choice for people dealing with complex conditions, particularly around mental health, pain, neurodivergence, mind-body issues? Why do you think we're one of the best places for people to come to?
I think that's an excellent question. And I feel like the reason is that most of us have a lived experience of chronic pain or mental health, or at least know someone personally who has experienced a complex condition or a mental health condition. So I feel like our own lived experience really helps us to build connections with people. We're all highly passionate people, and they'll really care about mental health and care about working with people and advocating for occupational therapy and how OTs can support people in the mental health and complex pain space. We are also a neuro and gender affirming practice. So we support people of all, ages, gender identities, neurodiversity, and we offer a safe place for people to be able to either come to our clinic. We have, worked really hard on making our clinic at Mount Lawley really welcoming, a really welcoming space. And also, we are able to offering appointments in the community at a place where people can feel safe, whether that be in their home or, at the park or at the river. We all love what we do. We love our jobs. We love our workplace. And if we have happy workers, we don't have a super high turnover of staff. It's because, we all value that kind of work-life balance. We all value self-care, making sure that we're not burning ourselves out. We spend a lot of, time on professional development and, a lot of team stuff that we do. So I feel like we're a very tight-knit group, and definitely I love working for LifeWorks. And Jacinta has supported me along my professional journey from a little baby OT to where I am now, and so I feel like that's why people should choose us.
Thank you, Holly. And it's been an absolute pleasure to watch you flourish as an OT at LifeWorks. And we're very, very grateful to be working with you. And I agree with you that it is a place that's filled with passion, and we really work to live to our values. So I think that's quite evident. So thank you very much, Holly. As Holly mentioned, if you are keen to have an appointment with Holly, Holly is based at Mount Lawley Clinic and also in Midland at Pain West, and does also offer home visiting in in a certain area of Perth, and telehealth-based appointments. And if you would like to know more, you can go to our website, www.lifeworksot.com.au, and have a look at what else is available there. So thanks very much, Holly.
Thanks, Jacinta.